So that's on here too. We believe in empowering communities to provide the options, the wisdom of your healthcare practitioner, of course, because there is a trust factor. But if you don't like your healthcare practitioner, change.
Change, absolutely.
You know, because you may have one who just thinks it's all bunk, and if you don't, then trust your own instinct, really,
and many times
isn't
it's personality. You click with someone, you know, so.
And the power of combining in anything we do in life makes sense.
And I think that's one of the important things that you said is about combination, because like in general, depending which, say, oncology team you talk to or who's running the show, some could be very conservative in recommendations, only our stuff and nothing else, right?
Right.
And I'm in the trenches every day too, so that's a part of it as well. And when I see patients, the ones who embrace kind of two worlds, seeing appropriate people on their teams, guess what happens? They tend to do better.
Sure.
And that's the trend that I see.
And all of us, I mean, I certainly tried to get out of treatment. Yes, I did. They said, a little this, a little that, little chemo there. I went, no. And he said, you're treatable and curable. You'd be crazy not to go here. But it was difficult for me because I thought, well, maybe I can just, you know, take a vitamin or a lot of them.
But I think a part like what also like you have to factor in is that like there was a new paper that came out looking at, say, advanced breast cancer. And they found that those who had a lower depressive symptoms, guess what happened? They lived twice as long.
Right.
You know?
Yes.
Is there a pill for that? Do you know, is that like what is the path to kind of to help in those kinds of areas?
Sure.
And so I think and the research again is supporting this whole movement. So I think if some oncology people or teams say, well, this is way out in left field, they better wake up a little bit, because
it's
the
not
data,
pie in the sky. And
yeah.
if you learn to meditate when you're taking treatment, great, because then you can use it when you're done.
That's right, and you can use that any time. You know?
How are you raising money for the foundation? How does that part work?
Well, we've set it up. So, I mean, our goal is to engage people who are, you know, younger, people who don't necessarily wouldn't donate. We've set up an online donation system. That was really important for us to you know, make sure that the bricks and mortars there were available, so people can donate online. People can donate monthly.
And can you apply online?
Or for the foundation?
Yes.
Absolutely. So once we do raise about we want to raise $50,000 this year, and that with that money we can probably treat maximum about 100 people. So, and that's a lot for a brand new young foundation. And we will have the system set up online, so people will be able to send an application for specific types of treatments. You know, we're not giving out medical advice in the foundation, so people have to know what they want to achieve and what they want to get.
And then you can do the math because you are the doctor and you are the nurse. No, I know you're not, but the partner of the doctor.
Absolutely, absolutely.
Thank you.
Thank you.
Thank you. Nice to see you, Dr. Walter Lemmo and Stephanie Klaus, and Thrive Alive Foundation is almost thriving.